Okay, Matt, now that I've done a quick postural and back screen, I'm just going to palpate some structures. Is it okay if I put my hands on you?
Yep.
Okay, would you mind turning around? All right. Would you mind lifting up your shirt? Okay. I'm just going to palpate, just touch upon some muscles and bones and ligaments, and just let me know if you feel any discomfort or pain throughout this process, okay?
Yep.
I'm just feeling for warmth here, any sort of swelling. Would you mind just bending forward? And coming back. Let me know if you feel any sort of anything, pain, discomfort, tenderness.
Nope, nothing.
Okay. Do you feel any difference between the two sides?
No, not really.
Okay. All right. I'm just gonna have you turn this way. Lift up your shirt for me, please. Okay. Just turn around one more time. For sure. All right. Thank you. All right, Matt, I'm just gonna have you put one finger here, and I'm gonna have you come up off your heels. Okay. So I'm just gonna demonstrate on one foot. You're gonna go like this, and you're gonna try to do this 20 times on one foot, and then we'll switch. Okay. Go for it. Okay, Matt, now I'd like to see you squat. So I just want you to get into as deep a squat as possible without any sort of pushing or a lot of pain, okay? So just go for it. How was that?
It was good.
Okay. Can you turn around? Squat again. Would you mind just turning to the side and doing the same sort of thing? All right. Now I'm just going to have you face forward, and I want you to stand on one leg. So pick whatever leg you want to start with. Okay. Now let's do the same with the other foot. Okay. Cool. Now I'm just going to have you do something called a climber's pose. So I'm going to have you stand here, put one foot on the chair, and lean forward, okay?
Both sides?
Yes. Hold that there. I'm just going to apply some overpressure. Is that okay?
Yep.
All right, come back. Now we're going to switch. Same sort of thing.
Yeah, a little pain in the front with that one.
Would you mind doing that one again, just so I can observe from this side? Okay. Come back.
So what I'm going to be doing is assessing your trunk motion. So what I want you to do is cross your arms right here across your chest and just twist to one side and then the other side. Good. Good. Is there any pain or discomfort with that?
No.
No? Okay. All right, Matt. So what I'm going to do is just check to see if you have any nerve restrictions. All right. So can you place your hands behind your back? Good. Now can you just slouch forward? Good. Can you straighten out this leg for me? All right. And can you point your feet towards you? Good. Do you feel any pressure or anything like that? Any pulling?
A little tightness in the back of the knee, yeah.
Okay, so maintain this, and I want you to look up. Does that get any better?
A little bit better, yeah.
A little bit better? Okay, so relax this leg for me. All right, now look down again. I want you to straighten out this leg. Good. And point this foot towards you. Good. Any pain, tightness, anything like that?
Same thing, a little tightness in the
Can
back.
you look up? Good. And does it get any better or worse?
A little bit.
A little bit better?
Yeah.
Okay, and relax. All right, Matt, so next thing we're going to do is check your strength, okay? So can you lift this knee up for me? I'm going to ask you to hold it for 5 seconds, okay? We'll be pushing down. Good, hold. Okay, gonna try this knee. Lift it up. Good. Hold. Good. Okay, can you straighten out this leg for me? And I want you to hold it there. 5 seconds. Hold. Good. Come to this side. Alright, good. Now what I'm going to be doing is I'm actually going to be pulling your leg out. I want you to try to bend your knee, okay? Go ahead. Okay, good. Same thing, go ahead. Good. Now can you point this foot up towards you? Okay. Just want you to hold it in. Okay, good. And now can you point your big toe up towards you, just the big toe? Hold that there. Okay. Same thing, point this foot up towards you. Hold it. Okay, and just point the big toe up towards you. Okay. Good. All right, Matt, so the next thing we're going to check is sensation, all right? So the way I'm going to be checking this is I'm just going to touch different parts of your leg just to see if your sensation is still intact, okay? So it's just going to be a light touch. I'm just going to show you like this. On your arm, is going to feel something like that. So what I want you to do is close your eyes and you let me know whenever you feel a touch, okay?
No. 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 No.
Alright. The next thing I'm going to be checking is your reflexes, so I just want you to relax. Good. Good. All right, Matt, I'm just going to check a couple more reflexes. Just relax the foot for me. Okay, good. Just relax.
Okay, Matt, so now we're going to just check your range of motion and your strength. So why don't I have you bring your right leg to your chest as far as you can. Okay, and I'm just going to do a little overpressure here. Okay, and then I'm going to back up a little bit and then push my hand here. Okay, and then why don't I have you bring down the table here. Okay, and then push here. Okay, and then right here, and then push up against my hand here. Okay, and then I'm just gonna bring, turn your leg in. Now push here a little bit. Okay, now push against my hand out. Okay, turn out. Okay, now push against my hand out this way, sorry. Okay, now I'm just gonna do, now bring your leg out like this way. Yep. Okay, now push against my hand here, inward. And then bring your leg in. Okay, and push it a little bit. Now push against my hand here. Okay, and then I'm also gonna check just a quick strength screen here. So push against my hand here. Now push up here. Now I'm gonna push this way. Now in. Now turn out. Sorry. Yeah. Now the other way. Okay. All right. Now I'm gonna just bring your knee to your chest as high as you can go here. Any pain with this one?
Yeah, no pain in the front.
Where? In the front? Right here? Okay. I'm just gonna push it a little bit and you let me know if there's any more pain there.
Yeah.
Alright, I'm gonna back off a little bit and then I'll have you push into my how's that?
That's good.
Okay. Alright. Now let's do coming down. Bring it down. Is there any pain here?
More of a stretch in the front.
Okay, I'm just gonna push a little bit here. How's that?
Same thing, stretch.
I'll back off a little bit and then we'll just push into my hand. Go on. How's that?
That's fine.
Alright. And then I'm just gonna do you turn your leg, your foot that way. Okay. Any pain here?
A little bit.
Same place?
More on the outside.
More the outside. Does that feel like a stretch or pain?
I guess a little bit of stretch.
I'm just gonna push a little bit more here. How's that?
Yeah, well, it gets a little bit painful with the pressure.
I'll back off a little bit and then you push into my hand here. How's that?
That's fine.
Turn outwards.
Yeah, that's painful.
Painful? Okay.
Yeah.
And I'm just gonna push it a little bit here.
Yeah, same thing in the front.
Alright, I'll back off and then push into my hand here. How's that?
That's fine.
Alright, and then can you bring your leg out? Any pain here?
No.
Okay, I'll push out a little bit. How's that?
That's alright. Just got a little crack though.
Oh, gotcha. And then push into my hand in. How's that?
That's fine.
And then bring this in as far as you can. Okay. Any pain here?
No.
Okay. And then push into my hand. Is okay?
That's fine.
And then I'm just gonna do this here. So push into my hand. Let me know if anything like this hurts. Okay. And then push up.
Yep.
Push into my hand here.
A little bit of pain in the front there.
The front here.
Yeah.
And then let's do this side. How's that?
That's okay.
Okay, and then let's also do push into my hand. Any pain here? Other side here.
That's fine.
Alright, great. So I'm just gonna check your hip and seat tracking here. And then just gonna check out how your leg moves. Just relax. Okay here?
You have some pain in the front
Pain
there.
And then, okay, Matt, I'm just gonna do a series of tests here. Just let me know if any of these cause you any pain, okay?
Mhm.
So here. Any pain with this one?
Yeah, in the front.
Okay. Here.
Yeah, same thing.
Same thing
Right in
here.
the front.
You okay here?
Yeah, that was fine.
And I'm just gonna do a scour. This is painful here.
Yeah.
And then come out.
Not as bad when you come out.
Not as bad. Okay. Alright, and then I'm just gonna lengthen just only here. You okay here?
Just a little bit of a stretch in the
Right
back
there.
of the knee.
Put this down. You okay there?
Same thing, just a stretch.
And then let's have you go on the side here.
My left side?
That
Right side.
Doing this side here. Do you have any pain with this one?
No.
Okay. Alright, and then keep your head forward. You okay here?
Yeah, just a stretch.
Stretch. Okay. Alright, and then let's have you go on the edge over here. Sit on the sore edge. And then sit on, scoot a little bit more. Okay, and then lean on back with both elbows. Hug this knee. So I'm just gonna. You okay here?
Yeah, just a stretch right in the front of the hip.
Okay. What about now?
Same thing, stretch.
Okay, here.
Yeah, a little stretch in the front, that's all.
What about now?
Same.
See?
Yep.
You okay?
Yep.
Same thing? Stretch?
Yep, same thing.
Alright. So on your stomach. You okay here?
Yep.
And then to the other side. Okay, Matt, so we're just gonna do it first test. Bring it up. And then we're gonna bring it down. You okay here?
Yeah, it feels tight.
Okay. Along here? Along this the side of the leg.
Yeah.
Flip over to the other side. Bring it up. And then come down. How's this one?
That's fine.
That's fine. Okay.
Okay, Matt, so what we're gonna do is just check to see the timing of your glutes and your hamstrings. Typically, we want to see your glutes firing before your hamstrings, okay?
Yep.
All right, so what we're gonna do is I'm just gonna place my hands here and I'm gonna have you bring your leg straight up like you're kicking the ceiling, okay?
Mm-hmm.
Go ahead. Okay, good. And one more time. Okay, good. And then I just want to check. I'm going to have you bring your leg up for me and straight up towards the ceiling and hold that. Don't let me push you down. Okay, good. And then now with your leg straight, I want you to do the same thing, okay?
Mm-hmm.
And hold. All right, so Matt, what we're going to do is further assess what's going on inside of your hip, okay?
Mm-hmm.
So I'm just gonna take your leg. Let me know if you feel any discomfort with any of this.
Yeah.
Yeah, it bothers you?
Mm-hmm.
Okay. And then I'm gonna perform a distraction over here. Again, let me know if you have any discomfort at any point, okay?
Mm-hmm.
Does that bother you?
A little bit, but not as much.
Not as much, okay.
Yeah. Definitely better.
So on your own, this is, where does it, do you feel?
There.
There. Okay. Goes a little bit.
Yeah.
Okay. Alright. And sorry, let's do one more in this direction to see if this helps. Can you hold your leg here for a second? Thank you. Okay. Still bother you?
A little bit, but
Little
not as
bit?
much. Yeah.
Okay. Does the other one work better?
I think so. Yeah.
Alright, Matt, so we're just gonna perform a mob just to see what's going on in that joint. Okay, so I'm gonna take your leg here. Okay, any discomfort?
Not yet. No.
Not yet. What about here?
Yeah. Yeah.
A little bit?
Yeah.
Okay. My hand here.
Yeah.
Yeah?
Yep.
Okay. Okay. And then we're just gonna perform a distraction of your hip over here. Also just to see what's going on.
Mm-hmm.
Okay. So last, put my hands here. Okay. Let's just see. Do you feel any discomfort here?
Yeah. Right in there.
Right in there. Okay.
A little bit, but it feels like I'm getting
More?
more, yeah.
Okay.
More of a stretch than anything.
Okay. Good. Okay. All right. So what we're gonna do is, when I did the joint mold, I noticed it feels like a hard end feel, which means there's some capsular restriction in that area. Okay. So in order to address that, what I'm gonna do is perform some joint molds. Okay. And then to help your hip glide a little bit better, what I'm going to do is perform a technique with a rope, and I'll walk you through that when I get there, okay?
Sounds good.
All right. So you let me know if any part of this, I know you're going to feel a little bit of discomfort here. Is this okay?
That's okay right
That's
there,
okay?
yeah. Yeah,
That's uncomfortable?
yeah.
What about here?
Not as much.
Not as much? What about here?
No.
That's okay?
Yeah, that's okay
All
there.
right.
A little bit. With
Where?
like at like the max pressure.
The
I
max
feel
pressure?
A little bit, yeah.
Okay. What about here?
No.
No? Okay. Okay. So what we're gonna do is perform a technique called mulligan with movement. All I'm doing is providing distraction to your hip and then trying to increase the range of motion in your hip, okay?
Mhm.
So I'm just gonna place this here. How does that feel?
Feels fine.
Feels fine. And how does that feel? Feels okay?
Yep.
All right. So now we're just gonna bring your leg up. How does that feel?
Feels good.
Any discomfort?
If you were to come further, I
Further?
would start to feel it.
Okay. Feels okay?
Yep, feels fine.
We're just gonna do this 10 times. Alright. And then let's just see if this has helped. And if it does, we'll do more.
Sounds good.
How does that feel? Feels good?
Yeah.
Alright. So after we did the structure burial differential, we noticed that he has a hard end feel. It feels capsular. So we decided to do some joint moves, grade 3 to 4, just to help loosen up the capsule. But as that is going to take a couple sessions to really take effect, we also decided to do mulligans with movement. We noticed with a caudal glide, it improved range of motion, so we did 10 reps. We didn't want to go further, seeing as how this is the first session.
Now I just want to apply some compression to your hips to see if that helps with your discomfort. Okay.
good. A little bit at the very end, but
Okay. Now I'm just going to see if you can turn on your trans abs here, which is just a muscle deep under here. I want you to feel like you're putting on a tight pair of jeans and contract this muscle right underneath my fingers, okay?
Yep.
All right, go ahead. Okay, I feel it turning on, so keep that, and I want you to hold it. Hold that. Keep holding it. Keep holding it. Keep holding it. Okay, and I start to lose it a little bit as soon as I move the leg, but how did that feel movement-wise?
felt okay.
Now I want you to try and do it by yourself without me putting my hands on you, okay?
So just hold the contraction and then.
Mm-hmm.
Start to feel it a little bit at the end.
Okay. I want you to think of the cue of putting on tight jeans, and I want you to use your hands to feel to make sure that the trans abs is turned on, and I just want you to move your leg just a little bit. I'm just going to feel here to make sure that they're still on. Okay, so I see that they're kicking on right here, so we're just going to use that movement right there, and we're going to give you an exercise with that, with this ball. So what you're going to do is put your feet on top of this, good, and you're going to move, perfect. You're going to use your legs to pull the ball a little bit towards you, and you're going to want to make sure that you feel the muscles underneath your hands turning on, okay? And we're going to try and hold that as long as we can.
Sounds good.
Okay, so what we're gonna do now for your first home exercise is like how we did distraction for your hip on the bed, we're gonna show you how to do it at home. Do you have a belt and a pillow at home?
I do.
Okay, great. So what you're gonna do is step your left leg through here and bring it up nice and high, like this. Get some distraction so it's nice and tight. Come into this position, and you're gonna rock back onto your heels, just like that 10 times. Okay?
Yep.
Do you need to see it again, or you understand?
I think I understand it.
Okay.
Yep.
So go ahead and give it a try. Once it's up on your thigh, kind of come a little towards the knee so you have that nice and tight. Yeah. Good. And we're going to do this for 10 reps at first while you're still a beginner at it so that we get your body accustomed to it and it's not overloading the joint too much. But eventually we want to have a goal of 3 sets of 10.
Sounds good.
Yeah, looks good. Okay, and now for our next exercise, we're going to be addressing that tightness you were feeling in the front of your thigh. So what we're going to do is take a knee down with the left, lunge up with the right, and you're going to lean into a nice big stretch that you're going to feel through the front of your left thigh. Hold for 30 seconds, and we're going to repeat that 3 times.
Sounds good.
Good, just come back and I'm gonna do a little correction. So with your hips, kind of scoop down a little bit while you're going into that lunge and try and hold it. Okay, and stop right about there. Do you feel a stretch there?
Yeah, if I
Okay.
went any further, it probably gets a little bit painful.
Yeah, because what you're doing is when you're going into it, you're kind of going into an anterior pelvic tilt, which looks like this.
Right.
So we want to make sure that you're in a neutral pelvic position. Sometimes what's helpful is if you kind of go back and forth like this, and then you find the nice in between and hold it there, then go back into your lunge. That looks better.
Yeah, it feels better.
Okay, so you remember this one from earlier when we were working on turning on these muscles right in here?
I do, yes.
I just want to make sure that you're still able to properly do that, so go ahead and show me. I'm going to feel first. And bring your feet back. Just throughout the range that you can maintain this. Good. And then you're going to be doing that self-palpating for that muscle turning on at home. 30 seconds, take a break, and repeat that 4 times as your exercise at home, okay?
Sounds good.
Okay, good. And then the next thing I'm going to show you is another exercise. You can stay right there seated. And I'll show you here.
So on your left leg, I'll show you here so you can see. You're going to bring your leg like this, and while you do it, as if you're kicking yourself in the head, put your head back. Then you're going to bend and put your head down just like that, and repeat. Good. So what this is doing is it's called a nerve glide, and it's going to help with some of that tightness you were feeling earlier when we found that during our assessment.
Okay.
For this one, you can, when you come back up, hold it for 2 seconds, and you're going to repeat 10 times. Okay, now for your last exercise, you're going to focus on how Jesse told you earlier to, like you're zipping up a tight pair of pants to activate that muscle here. And with your left foot, you're going to do some taps like this 10 times. You can go ahead and give that a try. I'm just going to feel to see if you're turning on properly. Good. And now you can do it yourself to make sure you're turning on. Once you're done with that 10, you're going to take a rest and repeat 10 times. Okay, so now that we've gone through all of those exercises, we want to see if everything we did earlier has improved or not. So first, why don't you show us the deep squat from earlier?
Sure.
And how does it feel?
Feels good.
Yeah, better
Yeah.
than earlier?
Yeah,
Good.
better than earlier.
And yeah, if you could turn around and do it one more time just so I could see this way. Okay. Looks pretty good. Okay, so now we're going to be reassessing the climber's pose. On the right side first, you can take a step up and go far into your lunge. How's it feel?
Good.
Okay, and now let's try the left leg. Forward pressure. Good, and come out of it. How did it feel?
Good.
No pain?
No
I'm
pain.
going to reassess earlier when we did a certain motion that brought on that pain. Let me know how this feels when I do this.
Still there, but it's not as like intense
Okay.
as it was originally.
Okay, so same pain, just less.
Yeah.
Okay, sounds good. Okay, so what we found today was that there is a few different things playing into this hip pain that you're having. One of the things is a capsular restriction, which is in the hip itself, which is what we did to work on with the distraction on the bed, and then how I showed you with the belt and the pillow on the ground. So that's why that's important for you to work on at home as well, because sometimes it takes some time for a capsular improvement to show. Secondly, we found some hip flexor tightness, which is the other exercise we showed you with leaning into that lunge. So you just want to remember too that your pelvis is neutral, like we showed you to find that when you're lunging forward so that it's effective in doing its purpose. We also found the nerve component a little bit, which we showed you those glides where it's like you're kicking yourself. So that one you want to try and do daily as well. And lastly, we had the trans abs, which is where we taught you to fire the muscle during your functional movement. So that's something we really want you to focus on as well with the ball at home. You said you do have a ball at home, right?
Yes, do.
Great. Okay, so all of this can be done daily. We would like to see you back in the office maybe 2 to 3 times a week so that we can continue to progress you forward. Do you have any questions?
I don't know.
All right, it was good to meet you.
Nice to meet you.
I'm on tonight.